I think at this point it's time to move into treatment. And we've talked about Tom's example, and we know diet is a piece of this, ketogenic diet in his case. But let's take a typical type patient. We know that right now depression is causing the greatest amount of disability worldwide. So let's use that as our example. I'm sure that's a common thing that you'd see in a patient. And let's talk about somebody who is moderately affected by that. And let's just use this as a hypothetical to talk about what treatment could look like when you're working with somebody using the brain energy theory.
The first thing that I would want to do with the person, moderate depression, let's hope for, I'm just going to throw in some disclaimers or caveats. I'm going to assume no life-threatening symptoms. So no suicidality, no suicide attempts, no self-injury, no heavy alcohol use or other substance use that's at least endangering their life. So bread and butter, simple, quote unquote, simple, at least for me, simple case of moderate depression. The first thing I would want to do is the treatment strategies kind of fall into two buckets. Bucket number one is we're going to identify all the things that are harming your metabolism or mitochondria. And we're going to make a list of those things, and we're going to do our best to try to address them. Bucket number two is we're going to think about strategies that we can develop that will enhance your metabolism or improve the health and number of mitochondria in your cells, because that will help you get better. The treatments are going to include biological, psychological, and social factors. So I didn't say this at the outset, but the very first thing that I'm going to do is I'm going to assess whether this person's depression is a normal human response to adversity, or if this person's depression is really a brain disorder, a metabolic brain disorder. It's a big difference. So the easy example I'll give everyone, if this is a man coming to me who says, I'm moderately depressed, doc, please help. And I ask him, like, what's happened? What's going on? Oh, my wife just 3 days ago let me know that she's divorcing me and she's taking custody of the kids. She has a new lover and they're moving out of state. I'm going to say, well, yeah, you are depressed. And like, of course you're depressed. Who wouldn't be depressed in that situation? And the treatment of choice for that particular individual is going to be talk therapy, more than likely. That person needs support. That person needs family support, community support. He might need a good lawyer. The treatments are common sense things. I'm also with that particular patient, I'm also going to make sure that he doesn't start engaging in behaviors that are going to cause him to fall off a cliff. So it's going to be natural that he's going to say, I can't sleep well, so I'm drinking alcohol to try to sleep. I'm going to talk with him about, no, let's get rid of that habit right now. Let's nip this in the bud before this becomes a really serious problem, because it is understandable. It is common for a person in that situation to start using a lot more alcohol to try to stop their thinking or their anxiety or to try to help them sleep. Unfortunately, alcohol is going to make everything worse. It's going to make their mental symptoms worse, and it's going to make the situation worse. And, the person might go off an otherwise healthy diet. The person might stop exercising. They might start, doing all sorts of things that are just not going to be good for them. So that's how I'm going to help that person. But that person's having a normal reaction to adversity. If we're talking about somebody else who says, I don't know why I'm depressed. I've been depressed like this for 3 years and I have a really good life. I don't know what's wrong with me. Like, I have a great job, a great family, great everything, but I just can't snap out of it. I'm just so depressed. I don't know what's wrong with me. So 2 buckets. I'm going to look for all of the things that are harming this person's metabolism. I'm going to ask them about drug and alcohol use. I'm going to ask them how their sleep is. I'm going to ask them about medication use. I'm looking for medications that might be harming metabolism. And harming mitochondria in particular. I am going to ask about exercise, ask about meaning and purpose in life. Again, it's not just biological. I'm going to look at psychological and social things. I'm going to ask about a history of trauma, any trauma symptoms, all of those kind of things. And if this person identifies 2 or 3 things that I think are harming his metabolism, we're going to first work to address those. So you're drinking a lot of alcohol. So that's going to be step 1. Let's get you off the alcohol. Let's see if we can go a month with no alcohol and just see what effect it has on your mood. For some people, treatment begins and ends there. That's it. Alcohol, 1 month later, I'm not depressed anymore, doc. Wow, who knew? Well, now treatment is, do you think you can keep it up? Maybe you should just not drink at all. Like maybe this is a new healthy way to be. Maybe let's go, a few months without alcohol. Some people won't buy into that. They'll, I've got to drink. I have to drink. Doc, come on. You can't, you're killing me. What's the point in being alive if I don't get a drink? So if that's what the person's saying, then I'm going to work with that person to try to figure out, okay, as you reintroduce alcohol into your life, let's really pay attention to those depression symptoms and make sure that they're not coming back. And then you're going to have to weigh the pros and cons of, do you want to drink and be depressed, or do you want to maybe be sober and non-depressed? That might be your choice. Or can we find the right balance of maybe you can get away with 1 or 2 drinks 1 or 2 times a week, and that is okay for you. So I'm going to do that with all of these other factors. If we identify some factors that are impairing the person's metabolism, get rid of them, and the person is still depressed, then I'm going to start looking at, let's maybe change your diet, use dietary strategies to improve your mitochondrial function. I'm going to maybe start a more rigorous exercise program. So even if this person says, well, I exercise like twice a week, I go for a run, maybe 1 or 2 miles at most, I'm going to be like, let's up your game. Let's up the exercise game, because exercise is going to improve metabolic health, mitochondrial health, and that might help your depression. So I'm going to kind of do both strategies. Remove offending problems and, implement things that are going to improve metabolic health.
And when it comes to the diet piece, we know the ketogenic diet is a piece of this, at least for some people. Does it always have to be that extreme to help fix metabolic health, or is there an in-between for people?
No, it absolutely does not. So for some people, if they're eating really depends on what the baseline diet is. It also depends on what symptoms people are having. If somebody is having chronic psychotic symptoms, diagnosed with schizophrenia, I have not found other dietary interventions to be very effective. I'll say that up front. So I probably am going to use the ketogenic diet with that person if they come to me saying, I want my voices and delusions to go away. But for other people, it can be as simple as step 1, let's clean up your diet a little bit. Let's eliminate processed junk food. If this person is eating a lot of sweets, things with added sugar, whether it's candy or sodas or whatever, let's see if we can get rid of the sugar. Maybe that's step 1. Get rid of the sugar, or at least reduce the sugar. Reduce the sugar to 1 or 2 times a week. Maybe on the weekends, if you go out to dinner, you can have it then, but let's just reduce sugar, see what impact we get. If that doesn't work, we might then transition more toward a kind of a whole food, real diet. So, and there are lots of versions of this. Some people like whole food plant-based diet. Other people like paleo diet. Other people like, they're all Whole 30. I mean, there are all sorts of versions of whole food diets. a lot of them are really effective for different people. So I don't think there's a one size fits all, but I would probably go more for a whole foods diet. So let's start getting rid of foods that are processed, foods that you can't find in nature, foods with ingredients that you can't pronounce. Let's get rid of all that stuff. And then I would progress. Might go more toward paleo, then might start going more toward low carb, then might start going toward ketogenic if needed.
One word I haven't heard you use yet when we're talking about diet is calories. So that leads me to believe at least a big piece of this is the composition and quality of food versus the amount of food. Talk about that.
Right now, so many people are focused. There are still a lot of people who are focused on calories. Like, all you got to do is count your calories and that'll take care of your weight and your metabolic health. The sad reality is like that we are losing the battle, and everybody's heard that for decades. Everybody has heard for decades. All you got to do is count your calories. And if you are capable of counting, you will not be overweight. It's really that simple. And in my mind, that is the ultimate fat shaming message. That if you're overweight, you must be really stupid and incapable of counting calories. That somehow you're just not doing the right math. And in fact, when the human body is functioning optimally, and this includes the human brain, when the human body and brain are functioning optimally, people's weight will regulate itself. They won't need to count calories. The overwhelming majority of thin people or normal weight people on the planet or athletic people on the planet, they are not counting calories. Their brain tells them when to eat, and their brain tells them when not to eat, and their brain tells them when to stop. And it's that simple. And what I would argue based on this overarching brain energy theory is that when we eat foods that contain unnatural ingredients, such as high fructose corn syrup or trans fatty acids, which thankfully are now outlawed in the United States, but I use those two examples because we have very good evidence for both. Both of them impair mitochondrial function. They disrupt the normal signals that control feeding behaviors. If you eat a lot of those foods, you will feel hungrier and or your metabolism will change so that even if you eat the same number of calories that you used to eat, now your metabolism is plummeting and you're not burning those calories as effectively, and that means the weight is piling up. But at the same time the weight is piling up, your metabolism broadly is also impaired. That means you're more likely to develop diabetes. It also means you're more likely to develop brain malfunction, brain metabolic dysfunction, and that means you might start having symptoms of mental illness. So I don't talk about calories for the most part with almost any of my patients. I am much more focused on trying different dietary patterns that will reestablish normal metabolic health. And once people are metabolically healthy, their weight will usually take care of itself. And although that sounds like maybe people think I'm wishful thinking or I'm living in some fairy tale land, I have patients with schizophrenia who've lost 160 pounds and kept it off. We didn't focus on calories once. We never talked about calories. I have other patients who've lost 70 pounds, 100 pounds, whatever. We never talked about calories. So what I'm saying, at least in my experience and my hands and the way I administer it, it produces real results. I know people are like, but I want to lose weight, so I need to count calories. What I'm telling you is no, you don't need to count calories. You need to restore your metabolic health. And once you do that, then your weight will take care of itself.
And I think it's important to point out at this point too that weight is typically something that is going to move up and down with metabolic dysfunction, as in you gain more weight and you're going to have more metabolic dysfunction. But for people out there that are using that as their only barometer to whether or not they have metabolic dysfunction, you can still be skinny and your mitochondria can be suffering.
Yes.
So talk about if you've seen that and a little bit more on the nuances there.
So we see it all the time. So again, but I think you're right. A lot of people think of metabolic health as you're either overweight or not. And if you're overweight, then that means you're metabolically unhealthy. And if you're normal weight or underweight, then you're fine. And that's not at all the way it works. And you can have regions in your brain that are metabolically compromised, and you can still be a normal weight. And so I would argue that if you are having symptoms of a mental illness, but again, not a normal reaction to adversity. So I'm not talking about the guy whose wife is leaving him being depressed. That is normal. That has nothing to do with metabolic dysfunction in his brain. That has to do with his wife is leaving him and he's understandably depressed. But for people who have symptoms of a metabolic brain disorder, meaning panic attacks, unrelenting depression for no reason, hallucinations, delusions, bipolar symptoms, whatever, those symptoms alone tell me as a neuroscientist that person's brain is metabolically malfunctioning. And that is important information on its own, because regardless of what the person weighs. So I think that, in some ways, this theory, the metabolic theory of mental illness, it simplifies the mental health field in ridiculous ways. It gives people with chronic mental disorders hope and practical, implementable, understandable strategies to improve their symptoms, put their illnesses into remission, and move on with life. The unfortunate news for the metabolic health community, people who are focused on obesity, if people who are focused on obesity think that the obesity epidemic can be solved with math, people just need to count their calories and eat less calories, and that'll take care of our obesity epidemic. What I'm here to say is you don't get it at all, and you don't understand science at all. You don't understand tens of thousands of research articles that have been published. So my message in some way simplifies the mental health field, because the mental health field has been so complicated and ineffective for a lot of people. But it does make the metabolic health field a little more complicated. But it all makes common sense. So it means that if somebody has trauma, we know that trauma victims are more likely to go on to develop not just mental illness, not just PTSD, but actually a wide variety of other mental disorders, depression, anxiety, personality disorders, but even bipolar and schizophrenia. But those people are also more likely to go on to develop obesity, diabetes, and cardiovascular disease. Those people are more likely to die early deaths. And so what I'm saying is that in order to understand metabolic health, we need to unite the mental health field and the metabolic health field together. And that's going to make the metabolic health field a little more complicated for some people who think it's all about counting calories. I guess that's my wake-up call to them.
Riffing off of something you mentioned a couple of minutes ago, and I got this from reading your book, that the brain is like the canary in the coal mine. So this ties back to when we were talking about obesity and the connection to metabolic health. You can almost use mental symptoms as a sign of metabolic dysfunction, because that is one of the first areas to go when our metabolism is compromised.
Absolutely. So a lot of people think metabolic health can be measured. Like you can measure your insulin levels or you can measure your glucose levels. And if your glucose is normal and your insulin is normal, then that means you're normal because you don't have insulin resistance. And yes, insulin and glucose are important biomarkers, and yes, measure them by all means. And if they are abnormal, it tells you that you are metabolically unhealthy. But precisely what you said, I'm arguing if somebody is having chronic, unexplainable mental symptoms like anxiety or depression or panic attacks or trauma symptoms or psychotic symptoms, if somebody is having those symptoms, that is a quote unquote biomarker, even though we can't measure. It's not really a biomarker because we can't measure it. We have to trust people to tell us it. So it's really a symptom. But I think of it as a biomarker of impending metabolic dysfunction. That is the first sign. It is the first thing to show itself. And when we hear about that from a patient, we need to think differently about that patient. We need to now think this person's brain is metabolically malfunctioning. And if we don't take care of this soon, this person is at high risk of developing all sorts of other mental disorders, which is true, but they're also much more likely to develop all of the metabolic disorders, which is absolutely true. We've got lots of research to support that. And they're also more likely to die early deaths. That is true too. So absolutely. Mental symptoms are the canary in the coal mine for a lot of people. We need to take them more seriously. The great news is that if we intervene in a metabolic way, we're also going to prevent all of those bad things that I just said. We're going to prevent them from developing obesity and diabetes and heart attacks and having premature death. We're going to help them live happier, healthier, longer lives. They're going to cost the medical system a lot less money. They're going to be less likely to be disabled. They're going to be tax-paying citizens. They're going to be living their lives with meaning and purpose. Like the system is going to win. This is a win-win, folks. This is a win-win. It is not going to cost the system more money. It's going to save the system money.
For somebody that's been listening and they're buying into what we're talking about today and they're saying, okay, I'm excited, I'm going to give this a try, but I've been affected by, say, depression for 30 years. And you talked about the example there of, life factors, things that happen, and that being a more transient example and a different example than somebody who is suffering from depression but can't really pinpoint the reason. So using an example of quote unquote real depression, what's the prognosis like when you work with people that have been suffering for a longer period of time, say 20, 30 years, versus somebody who is only, say, 6 months, a year into it? Do they recover quicker if they get to this sooner? And is there a possibility for a bigger full recovery with more acute cases versus chronic?
The real answer is that even when I see people with chronic mental disorders, if they are able to do like the dietary strategies and some of the other strategies, I actually see remarkably high remission rates even in them, even with chronic schizophrenia or chronic bipolar disorder, certainly chronic depression like you described. The couple of caveats to that, there are a few caveats that make the chronic person, the person who's been suffering for 30 years, there are a few things that are going to make it harder to treat that individual. The first one is addiction. The longer somebody has a mental disorder, the more likely they are to get addicted to substances of abuse. they're much more likely to start smoking cigarettes and be addicted to that, or vaping and be addicted to that, or use marijuana or use alcohol. And so if I'm dealing with somebody who's got a chronic disorder and they also have comorbid addictions on top of it, it makes the treatment harder to do and harder to stick with for those people. So that's kind of one of the differences. Possibly the bigger difference is when somebody's been severely depressed for 20 or 30 years, they have often lost so much in their life. A lot of them are disabled now. They've lost their career. And that career is gone. Maybe they never even had a career. But if they did, it's gone. I have patients like that. They became severely depressed, engineer, used to have a great job. When you're disabled for 20 years and you haven't worked as an engineer in 20 years, you can't go back to that as your job. Not without a lot of training. You'd probably have to go back to school. You'd probably even have to get a new degree or something, or at least take training courses. And some of them have also lost relationships. When you're chronically depressed for 20 or 30 years, there's a good chance, there's a higher probability at least, that your spouse has divorced you, if you ever even had a spouse. If you never had a spouse, there's a good chance you never even had a boyfriend or girlfriend, significant other. If you do have, say, a family, your family is often disgusted with you. They just think of you as like a lazy, incompetent blob. So you've lost their respect. All of those things are harder to get back. So if I can, if let's say the person doesn't have a serious addiction, and I implement diet, lifestyle, exercise strategies, and I get that person dramatically better in 6 months, which I think is very possible. Now I've got a metabolically and mentally healthy person, but they still have an uphill battle. Now they have to find a purpose in life. They have to think about, am I going to go off disability? What kind of a job could I get? How much will that job pay? Is that job going to pay as much as disability pays me? Because if it doesn't, I can't afford to lose even more money. I can't afford to go work for minimum wage somewhere if my disability check is more than my minimum wage job will pay me. And if they don't have job training, if they haven't worked in 20 years, it makes it really challenging. If they don't have relationships, that makes it really challenging. Because helping them be less depressed, or even not depressed at all, doesn't give them an automatic social group. Now they have to go through the work of trying to find a social group, trying to find somewhere to fit in. And unfortunately, society is not kind to people who have been disabled for 20 or 30 years. One of the first questions everyone asks you, if you go to a group to meet people, say you go to a meetup group and just try to hang out with, make some new friends, one of the first questions they're going to ask you is, what do you do? And if your answer is, oh, I've been depressed and disabled for 20 or 30 years, it just doesn't make you a lot of friends, unfortunately. So I do have to acknowledge that these are real issues and real challenges that to this day I am working on with some of my patients who I'm helping them get better. They're restoring their brain function. And now we have to try to figure out, how can you fit into society again? Where are you going to fit? How are you going to make friends? How are you going to start dating if that's important to you? Can we teach you the skills to live independently? Because again, it's not just brain function. You have to know how to pay bills and how to manage your affairs and do all your grocery shopping by yourself and everything else. And if you've had people taking care of you because you've been disabled, it can be rough. So I want to, sadly, I know that's kind of a downer. I will say this. I would so much rather be helping patients with all of those tasks than listening to them complain about how they're depressed and suicidal week after week, how their voices are tormenting them, how the delusions are tormenting them. I would much, much, much rather be dealing with these other problems of, how am I going to help you now develop a meaningful life? How am I going to help you integrate yourself into society again? But this is one of the things I'm calling for, and kind of my call to action is that we need treatment programs and systems that are going to help these people. Like, once we help them recover, once we restore their brain health, now we need to help them reintegrate themselves into society.
That's such a good point. And from somebody in my shoes, it's a whole perspective. And I'm glad you went into that, because only somebody in your shoes seeing, these people recover firsthand would realize that there's this whole other aspect of recovery and re-ingraining themselves back into an old lifestyle, or if it's been going on for long enough, a new lifestyle that they've never actually had. So very important. I'm glad you went into that.
Thanks. Yeah.
So we really went into the diet piece. We know the ketogenic diet is a starting place, at least for people that are more severe with their mental health challenges. How do you feel about supplements? And I want to caveat this and say that we're talking about supplements that go along with that diet we already talked about. So we're not using them as a replacement to continue our crappy diet from before, but if we're going to make the dietary changes and then try and fill holes with supplements, or specific supplements that we can take to help with mitochondrial health. How do you feel about supplements?
I will say this. It is early days right now in terms of rigorous research showing benefits. There are lots of supplements. I went through a whole laundry list of supplement names in the book on supplements that are touted to improve mitochondrial health or help with mitochondrial health. We've had some research studies with bipolar disorder or schizophrenia or chronic depression, where without changing anything else, without changing diet, keeping people on medications that cause metabolic harm, that giving people supplements, even like 20 supplements all at the same time, does not seem to work. That's the bottom line of that. So supplements on their own will not fix metabolic problems as a rule of thumb. Obviously, if somebody has a nutritional deficiency or a hormone deficiency, that can be the game changer. So if you are found to have vitamin B12 deficiency, for instance, a B12 supplement or shot or pill could be your magic bullet. Want to say that up front. But there was just a study published the other day of 3 mitochondrial supplements in people with Alzheimer's disease, and it improved their cognition. That is not really happening in medication trials for Alzheimer's disease. So I think there is so much research to be done in this area. Which supplements, how much of those supplements, for whom, how long. all of those things that I think there are so many exciting possibilities for appropriate use of supplements with some patients in some phases of recovery. No doubt about it. And I'm actually really excited about some of those supplements and some of the early data on them. But the caution that I just want to say, because I get asked this a lot. So tell me what, because at the end of the day, everybody likes just taking a pill and thinking that's going to solve their problem. So they ask me exactly this question. So Chris Palmer, if it's a mitochondrial problem, tell me what pill I can take to fix my mitochondria. And they want a supplement. They want a mitochondrial supplement. CoQ10, that's supposed to be good for your mitochondria. So if I take CoQ10, that'll fix my schizophrenia, right? Wrong. Let me be clear. Wrong. Doesn't work. It's actually been tried. Does not work. So do not think that the majority of kind of situations, like exercise is something that enhances mitochondrial function. We don't have a supplement that mimics all of the benefits of exercise. We don't have exercise in a pill. So people shouldn't expect to see all of the metabolic benefits in one pill.
Very good explanation there, and I get where you're coming from. But for somebody who is dealing with a mental health challenge, just as a core handful of supplements just to support general health during recovery and beyond, do you have like a certain 3 or 4 supplements that you recommend to people, whether it be fish oil, vitamin D, probiotic, things that are really general to fill in possible gaps? And if you don't, that's fine. I understand where you're coming from before, but do you have something that's kind of like a bread and butter baseline supplement pack?
Bread and butter, I would say, if you're starting a diet, especially something like the ketogenic diet, take a multivitamin, a good bioavailable multivitamin. Let's start with that. Omega-3 fatty acids, we know that omega-3 fatty acids play a really important role in mitochondrial function, actually. They are integrated primarily in mitochondrial membranes, not the cell membrane. So when you take omega-3 fatty acids, it is primarily for your mitochondria and their health. However, we just got this, like a year or two ago, we just got this really large randomized controlled trial of giving middle-aged adults a fish oil supplement to see if it would prevent depression in them. And the bottom line is it did not work, unfortunately. So although I want to say, sure, why not? Go ahead and everybody take fish oil. The data actually suggests it may or may not, it may not be as beneficial as we had hoped. Instead, for omega-3 fatty acids, I would highly, highly recommend fatty fish, salmon, on a regular basis, at least once or twice a week, and that will probably help you get your omega-3 fatty acids. I do think it's hard for me to recommend, but some of the NAD supplements, so there are precursors to NAD, NMN, nicotinamide riboside, and some other ones. There are lots of versions of this. Those do appear to improve mitochondrial health. They also appear to improve kind of gene regulation and genetic health. But again, I've seen a couple of disappointing study outcomes with some of those molecules, that they've given those supplements to people, for instance, with fatty liver disease, and it didn't seem to work, unfortunately. You would think it would, but it didn't. And that's why I kind of said what I said before. I think the bigger money is to do the real medical kind of workup of what's causing the problem. Let's address it. And then let's implement some broad lifestyle factors like exercise and diet, which are going to be so much more powerful than any supplement could ever be.
So you mentioned fish there. Fish aside, any other specific foods, no matter what diet paradigm somebody's, well, I guess not whatever, because if they're vegan or vegetarian, they're not going to be into fish. But specific foods that people want to include that are really good for brain health?
Eggs are really good if you're, even if you're a lacto-ovo vegetarian, that might be. Eggs are great. They have choline and iron and all sorts of things. You want to make sure you're getting adequate protein. And there's all sorts of controversy about how much protein do people need. But we know that muscle mass, if you have muscle on your body, that means you have more mitochondria in your muscle cells. And those mitochondria are actually sending all sorts of metabolic signals throughout your body that impact your brain. So people who have more muscle mass are going to have healthier brains. They're also more likely to live longer lives, and they actually have higher survival rates from cancer treatment, for instance. If they do develop cancer, they're much more likely to not die from cancer. So all sorts of benefits from muscle mass. And it doesn't mean you have to go out and be a big bodybuilder. And women, don't worry, I'm not asking you to look like Arnold Schwarzenegger. But trying to improve your muscle tone or muscle mass is good. And that requires protein, for better or worse. You're not going to build muscle with anything other than protein. Fruits and vegetables. So definitely, especially if you're doing like even a ketogenic diet, you can still have fruits and vegetables. Those are really good for gut health. They result in short chain fatty acids, which actually serve as a fuel source for the mitochondria in your gut cells. The cells lining your gut, that's why short chain fatty acids are all the rage. If you get more granular and specific, they end up in mitochondria in your gut cells, and that helps your gut cells be healthier. And that means your gut is less permeable. You're less likely to have a leaky gut. It helps those gut cells send the appropriate endocrine signals that they are supposed to be sending up to your brain, all sorts of things. 95% of the serotonin is produced in the gut. And that is probably playing a role in depression and anxiety disorders. So gut health is important. And, and then that gets into the microbiome. So I would say fruits and vegetables broadly. Which ones? It starts getting, because then it starts getting on what kind of a diet are you trying to do? Because again, it's a balancing act of, if I'm trying to be keto, for the benefits that a ketogenic diet can confer, that might mean that some fruits and vegetables I'm not going to be able to eat. And it doesn't mean that those fruits and vegetables aren't good for anyone else. If another person doesn't need keto, some people might be thriving on a paleo diet, for instance, and they should be eating potatoes, and they can be eating all the fruits and vegetables and all sorts of things that they want, and that's all good. So it's hard to make universal food recommendations.
I hear you. And for somebody who is suffering mentally in the severe category and they've gone to the ketogenic diet as a way to help them recover, is that a cyclical ketogenic diet, or typically does that person need to be on ketogenic 24/7? How do you work with that?
I use the ketogenic diet like the epilepsy field uses it. And that means that at least for the first 2 years, I'm looking for ketogenic diet 24/7. What I will tell you just from my own experience, I have seen patients with schizophrenia, bipolar disorder, who have essentially had dramatic remission of illness on a ketogenic diet. And like 5 months in, they actually become convinced, I'm fine now. I don't need this diet anymore. I'm cured. I'm all set. They go off the diet, and within 24 to 48 hours, their psychosis is back, or they're having a severe mood symptom. They're having severely depressed or manic or something. So And that's what they find in the epilepsy field as well. In the epilepsy field, patients are usually told you've got to do this for a minimum of 2 years, because if you break the diet, there's a good chance your seizures will come back with a vengeance within 24 to 48 hours. However, once people do the diet for 2 years, and the range in the neurology field is usually 2 to 5 years, the clinician will work with the patient and the dietitian to figure out, okay, how long should this particular patient be on the diet? And they're going to base it on other symptoms that you've been having, whether your seizures are all the way gone or not, all sorts of things. But for most people, they can stop the diet after 2 to 5 years. They don't even have to do cyclical anymore. They can stop the ketogenic diet and maintain all of the benefits that they got. That the ketogenic diet results in permanent increases and improvement in mitochondrial function in those brain cells. And once we do that kind of quote unquote reset, you can think of it as a reset for those brain cells, that we are improving the metabolic health in those brain cells. And once those brain cells are metabolically healthy, you can eat a regular diet and maintain that health for potentially your lifetime. So a lot of those people, a lot of people in the neurology field will do it for 2 to 5 years. Right now in the mental health field, we don't have enough data and enough people for me to be able to give clear recommendations on that, unfortunately. But I'm hoping that for most of them, it will end up being this 2 to 5 year thing. I've certainly had some patients. Most of them don't go most of them don't go to an awful standard American diet when they get off, but a lot of them can go to something more like a paleo diet, or they start getting carbs and they're clearly not in ketosis anymore, and they can be thriving. They can do extraordinarily well. But it's usually like, they've been on the ketogenic diet for 3 or more years already.
So we've went deep into the diet piece. We've talked about supplements, but now I want to get into when we eat. So time-restricted eating, intermittent fasting, how does that play into things with patients and their mitochondrial health?
So fasting and intermittent fasting can play a role for some people. For some people, it can actually be a really important part of treatment. It's a strategy to increase ketones. So when I'm working with patients who are really, who have come to me with a serious mental illness, such as hallucinations, delusions, serious mood symptoms, if they go off the diet, or if they get stressed, or they're not sleeping well, or something happens and their ketone levels go down and their symptoms are coming back with a vengeance, and we see that direct correlation, like your symptoms are coming back with a vengeance, and your ketones are down. Sometimes I will have them do an intermittent fast or a fast. That is the most rapid way to elevate ketones. For other people, I've talked with some clinicians who simply implement kind of more paleo diet plus or minus intermittent fasting. Like, let's see if you can just have 2 meals a day. Eat as much as you want at those meals, but 2 meals a day with paleo diet, or 2 meals a day with a low-ish carb diet. I have some patients who, as part of their ketogenic diet routine, will typically skip 1 or 2 meals. They'll only eat, 1 or 2 meals a day. And so the good news is that there are lots of variations. You can work with people, find out what's doable for them, find out what makes the diet easier, and balance that with what clinical benefits are you looking for and how are the best ways that you can achieve those clinical benefits. So there's no one size fits all.
Chris, I know you got to go. We're going to end on this though. We did talk about supplements, but I want to talk about exogenous ketones. So what I'm getting at here, is this something you recommend? And the reason I ask it, I'm curious how much of the role of the ketogenic diet comes from the ketones that it produces, having that positive effect on metabolic health.
It's an important question. There are studies getting underway looking at exogenous ketones for a variety of mental and neurological disorders and also metabolic health conditions. The simple answer for me is that to date, I'm not aware of any human being who has been able to stop their seizures using exogenous ketones. And so the ketogenic diet is a 100-year-old evidence-based treatment for epilepsy, and yet we don't have even one case report of anybody being able to stop their seizures simply by drinking ketones. And the reason that's important to me as a psychiatrist is because we use epilepsy treatments all the time. So the fact that exogenous ketones don't stop seizures strongly suggests to me that exogenous ketones may not stop mental symptoms. I can tell you I have tried exogenous ketones in many patients of mine, and they have not worked. They have not done the miracle things that we all hoped they would do. It's a small number of patients, and that's why I talked about that my logic. There's not even one human example of anybody stopping their seizures. So I would say exogenous ketones may definitely play a role, and there are many uses that we can think about using them in terms of diagnostic testing, in terms of augmenting low carbohydrate or ketogenic diets for people who can't get their ketones up. Possibly, there are the benefits in terms of performance, mental benefits. Lots of health and wellness gurus are drinking ketones these days and swear by them. So I'm not against exogenous ketones. I'm excited about more research on them, but I don't think they are the magic bullet that everybody hoped they might be.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
This is the missing link that we have been searching for when trying to understand mental disorders. It is so obvious. It has been hiding in plain sight, and we have over a century of scientific